the Jewish Alliance for Dialogue and Engagement. Together with the Marion and Aaron Gural JCC, we are honored to bring you this important webinar about the COVID-19 vaccines. We know these are incredibly challenging times. Like many of you, I miss gathering with my family, my friends, and yes, my regular life. 2020 has been full of fear, pain, and loss. COVID-19 has decimated our communities, our country, the world. We've seen firsthand that it does not discriminate. It doesn't care if you are rich or poor, Black or white, young or old, healthy or not. Now we can finally see a path to turn things around. It will take great effort, but we as a country have overcome great challenges before, and we will do it again. As long as we come together, we can heal together. Aaron?
Hello, I'm Aaron Rosenfeld, the CEO of the Marion Aaron Gural JCC. Thank you for joining us tonight for this very important conversation. We are thrilled to have such a distinguished panel and moderators and the support of our elected officials, Kathleen Rice, Todd Kaminsky, and Laura Curran, who can always be counted on to support our community. For 40 years, the Gural JCC has been a safety net for those in need in the Greater Five Towns community. The challenges of the pandemic this year have truly tested our ability to meet the growing needs. Yet with your help and the work of our amazing team, we've made sure that no one went hungry or felt isolated. We gave out over 250 tons of food and are now serving over 1,000 families at our kosher food pantry. We have also distributed over $120,000 of emergency cash to struggling families. We check in on hundreds of seniors daily, including our Holocaust survivors, and thanks to Nassau County and Mount Sinai South Nassau Hospital, we were a drive-through COVID testing site. We have provided a feeling of safety and stability for many during this time of uncertainty. There now appears to be a light at the end of this long COVID tunnel. We can all be part of the solution, and the accurate dissemination of information is essential to a clear path forward. That is why we've collaborated with JADE to bring you this important conversation about the COVID vaccines. Thank you for joining us and doing your part in bringing an end to this pandemic.
We know that there are numerous concerns about the safety of the COVID-19 vaccines, whether from the lack of information, vaccine skepticism, or anxiety about the pandemic itself. We hope to answer many of them tonight, as well as questions submitted to us by all of you, the general public. We have a great panel with lots of information to share, and we will get to their introduction shortly. But first, please welcome our distinguished representatives. Congresswoman Kathleen Rice represents New York's 4th Congressional District on Long Island. First elected to Congress in 2014, Representative Rice is a career prosecutor and a leading Democratic voice on national security issues as a member of the Homeland Security Committee. As a member of the Veterans Affairs Committee, Congresswoman Rice has been a fierce advocate for accountability at the Department of Veteran Affairs. Earlier this month, she was named to the exclusive House Committee on Energy and Commerce, which has the broadest jurisdiction of any authorizing committee in Congress. I'd like to welcome Congresswoman Rice.
Amy, thank you so much. It's a pleasure to be here with you and everyone on this panel. They are colleagues and great friends all. And I want to thank JADE for organizing this really important event. I'm going to speak very briefly because the conversation is the most important part of this. I just want to give you an update as to what we've done in Washington to address this pandemic. Back in March, we passed the CARES Act, where Congress allocated $10 billion for the vaccine development program, which has commonly been referred to as Operation Warp Speed. And there has been, as I'm sure Dr. Glott will talk about and Dr. Eisenstein will talk about, has been very successful up to this point. We also were down in DC last week and we passed a bipartisan relief package, finally, signed by the president that allocated an additional $30 billion to support vaccine and therapeutic development, the purchase and distribution and buildup of a national stockpile as well. It includes $300 million for a targeted effort to distribute and administer the vaccines to high risk and underserved populations, including racial and ethnic minority populations and rural communities. We also allocated $55 million for continued work on FDA efforts to facilitate the development and review, both pre-market and post-market, of medical countermeasures, devices and therapies and vaccines to combat the coronavirus. When it comes to allocating the vaccine doses, though, we are all aware that each state is responsible for its own plan. In New York, we vaccinated 140,000 residents already, and we're expected to have received a total of about 500,000 doses of both the Moderna and Pfizer vaccines by the end of the year. And like the places in the rest of the country, New York is focusing on the highest risk groups first: healthcare workers in hospitals, workers in nursing homes and group homes, and the residents in those facilities. Then we will move on to higher risk populations in the general public before mass distribution. I look to hear what Dr. Fauci has to say in terms of estimating when there's going to be widespread distribution, and it's, according to him, it could be sometime in the late spring, early summer. Under the direction of the House physician and in accordance with the continuity of government rules, I received the first Pfizer shot as part of the vaccine, along with dozens of my Democratic and Republican colleagues in the House and Senate. I got to be honest, I didn't feel comfortable getting it because there are far more people in more vulnerable positions than I. But as I have from the very beginning, I have always listened to the guidance of the attending physician and other health experts. And that is why I began that vaccine process. I do hope that people seeing elected officials on both sides of the aisle get the vaccine, that will inspire public confidence in its safety and efficacy. And I know that's going to be a large part of the conversation here tonight. Lastly, very important part of the bipartisan compromise bill that we just passed, included in that was putting an end to the practice of surprise billing on the federal level. We are lucky here in New York State. We already have that protection. Patients already know that they cannot be hit with any surprise billing because there is a state law preventing that from happening. And so much of the federal bill that we just passed was based on how we do it here in New York. So that you have the provider and the insurance company duking it out, and it's not the patient that gets stuck with the bill. It's an issue that happens a lot more than you'd think, and I'm thrilled that we were able to extend these protections, especially now when we're talking about this widespread vaccine distribution, which as it continues, we also have to ensure that patients don't, fear that they're going to get, first of all, that they have confidence in the efficacy of the vaccine, first and foremost, and that they don't think they're going to be hit with a huge bill at the end. So I want to thank JADE for putting this wonderful event together. Amy, you're wonderful for doing this. I'm looking forward to hearing my good friend, our county executive, Laura Curran, talk about what's currently going on Long Island. Obviously, she's going to speak more about this, but the numbers are going in the wrong direction here. And so I'm glad that all of us can be here to talk about this, this issue at such a critical time. So thank you all again. I look forward to the conversation.
Thank you so much, Kathleen. And speaking of Laura Curran, the Nassau County executive, Laura has been the executive since 2018, when she became the first woman to hold the office. Representing more than 1.3 million residents, County Executive Curran has prioritized restoring trust and fiscal controls to the budget process, working with local municipalities to foster economic development and producing good paying jobs and housing options for people of all income levels. Since COVID has hit, she has led Nassau County's response to protect and inform residents while maintaining essential county operations and advocating for small businesses and schools. I'd like to welcome Laura Curran.
Hi, everyone. Thank you so much. Thank you, Amy. Thank you, JADE. And thank you to the Gural JCC for your partnership throughout this pandemic. Whether it was the food drive or being a site for rapid testing when we saw cases really spike in the 5 towns, you've been right there with us, and I'm really grateful for that. So I also just want to give a quick thanks to Kathleen Rice for fighting in a bipartisan manner down in DC for us here back home. She's done a fantastic job. And she indicated something very true and very troubling. We have seen our numbers, our COVID numbers, really go up over the past couple of days. In fact, today we're at over 10% of people being testing positive. So that's the highest we've been in a very long time. We have 3 times as many people in hospitals with COVID since Thanksgiving Day. So the numbers are not going in the right direction. I mean, we're very excited about this vaccine, and thanks to Kathleen for getting that shot and showing the rest of us that it's safe. I think we're all ready to get it. As you know, the state is really calling the shots in vaccine distribution. So here on Long Island, Northwell has been designated as the hub for distribution in our region here on Long Island. So Dr. Eisenstein, who is our wonderful health commissioner for the county, and I have been speaking with Northwell. I was in a big call with the state today about distribution. So we're hoping to get more details in the coming days. I'm sure Dr. Eisenstein can fill us in on the latest. I know starting next week, pretty much anyone who works in a healthcare setting, will be eligible for the vaccine. So that's very, very good news. The thing that I'm most excited about with the vaccine, obviously, is keeping people safe, keeping people from going to the hospital, keeping people alive, is getting life back to normal. So as we at the county and all levels of government have really been dealing with the health crisis, been dealing with, on the county level, we're doing the contact tracing through our health department. We've got the ambulances. We've got, unfortunately, the morgue that's been dealing with this as well. We've got all the outreach agencies, law enforcement, et cetera. It's really important that we get the word out in a very consistent way that the vaccine is the path to normalcy. We want to keep our kids in school. We want to make sure our businesses can continue to function. We're not looking for more restrictions in our restaurants and our businesses. We want to keep the economy going. So we're in this strange in-between phase right now while we're waiting for wide and equitable distribution of this vaccination. And we're going to talk about that as well. It's very important that it is equitable, that it is distributed to all of our communities in a very equal way. We also need to build trust that it's safe, that it's effective, and that it is the way to get back to normal. So I'm looking forward to a robust conversation. I want to thank JADE for starting this conversation. And I want everyone to know, as information becomes available from the state, from Northwell, we will be there to give you the latest information to, save lives, keep people safe, and get our economy going again. So thank you very much.
Thank you so much, Laura. And it's my great pleasure now to introduce our co-moderator, Dr. Alyssa Hirsch.
Thank you, everyone. It's an honor to be involved with this wonderful initiative and to introduce esteemed colleagues and new friends who will serve on this panel. To begin, I just want to introduce the panelists. Dr. Aaron Gural is the chair of the Department of Medicine at Mount Sinai, South Nassau. He also serves as the chief of infectious disease in the hospitals and as the hospital's epidemiologist, and is in charge of our Infectious Disease Society of America designated Center of Excellence in Antimicrobial Stewardship. Dr. Lawrence Eisenstein is the Commissioner of Health for the Nassau County Department of Health on Long Island. Dr. Eisenstein oversees the health of approximately 1.35 million residents in Nassau County. He is also a board-certified physician in infectious disease. Dr. Andrea Alt-Brutus is the Director of Health Equity for the Nassau County Department of Health. Dr. Alt-Brutus has almost 20 years of experience improving health outcomes and access to quality health care for the vulnerable and underserved communities. Next, Farah Mazawala, the Executive Director of the Nassau County Office of Asian American Affairs. She is focused on the healthcare needs of marginalized communities and served as a strong advocate, and she has recently been appointed to the Health Equity Task Force. And finally, nurse practitioner Blima Marcus. Ms. Marcus is a public health advocate. She's also the founder of MS Initiative and has done incredible work lecturing widely on increasing vaccine confidence in providers and for parents. Her work has been featured in the New Yorker, Wall Street Journal, and Washington Post. Thank you to all of our wonderful panelists. We thank you for your time and your participation. We're going to begin tonight's activity with discussing a brief overview of the COVID vaccines by Dr. Gural. We have many questions that came in from the audience prior to the event, and we'd like to just start, if we could ask Dr. Gural to please provide us with a general overview of the 2 currently available vaccines by Moderna and Pfizer.
Thank you very much, Dr. Hirsch. It's an honor and a pleasure to be here. I would just also thank the sponsors of tonight's program, JADE and Gural JCC, for doing this. It's a wonderful thing. And I'd also like to especially note how the one good, if you wish, silver lining of this horrible pandemic has been the opportunity to work with such wonderful public officials and other people that I might not have had a chance to work with otherwise. And certainly Congresswoman Rice, County Executive Curran, and Commissioner of Health, Dr. Eisenstein, have become good friends and wonderful public officials. And it's an honor and a pleasure to work with them, as well as the other members of the panel tonight. I'd like to thank them for the hard work that they've done. So I have a very few minutes to talk about a subject that should take several hours to talk about, so I'll talk very fast. There are 2 vaccines that are currently available in the United States under special FDA emergency use authorization. Today, a 3rd vaccine was approved in the United Kingdom, the AstraZeneca vaccine, which has also produced good results and will hopefully get approval in a similar fashion that the Pfizer and Moderna did in the United States in the next couple of weeks, if not month or 2. I won't spend a lot of time talking about that vaccine, but the more vaccines that we have worldwide, and especially here in the United States, the better it is for everybody. And all of these vaccines, the preliminary data, everything that's been published about them, all show that they're effective, slightly different levels of efficacy, essentially the same great level of safety. And there are additional vaccines that will be hopefully coming to market after the AstraZeneca comes to market. And that includes vaccines from other pharmaceutical companies in the United States, as well as Russian and Chinese companies. Therefore, this is a critically important thing, that there be enough vaccine, not only for the United States, but there be enough vaccine for the world. But I'll try to focus tonight on the 2 that are available now in the United States, the Pfizer BioNTech vaccine, which we'll call it the Pfizer vaccine for short, and the Moderna vaccine. These are both a relatively new type of technology that's actually been around for about 20 years. So therefore, there are some new things about it, and I think it will be revolutionary in terms of other vaccine development, the things that we've been less than successful for. So it's very, very promising outside the COVID world, but we'll focus tonight on their use in COVID. This technology basically allows us to vaccinate people with almost no risk. You're not giving them a live virus. You're not giving them a weakened virus. It is impossible to get COVID from getting these vaccines. That's something that everybody has to understand. There's zero risk. We don't say too many things in medicine are zero risk. This is zero risk. You cannot get COVID from taking these vaccines. There will be people that will develop COVID after getting the vaccines because of exposures to COVID. And we have seen this, unfortunately, too frequently, as we have a high incidence of COVID in populations. In the United States, especially amongst healthcare workers who are getting vaccinated, they're constantly being exposed in their professional and unfortunately sometimes in their personal lives to COVID. So it's not surprising that some people get COVID after chronologically getting the vaccine, but it has nothing to do with the vaccine. I've gotten a lot of questions about that. That's absolutely crystal clear. Not one shred of suggestion. It's related to the vaccine itself. The vaccine doesn't give you virus. It gives you something called mRNA. Now, mRNA cannot integrate into your DNA. It cannot change your genetic material. It's out of your body in a relatively short period of time and will not cause any long-term permanent changes in your genetic structure. Again, zero likelihood that that can happen. So this is something, again, people are nervous about. I'm getting something genetic. You're not. You're getting messenger RNA, which your body produces all the time. And what that does when you get injected with it is it tells the cells in your body through this messenger RNA, mRNA, to start producing the spike protein, but only the spike protein, nothing else about the virus. Now, when your body produces the spike protein, your body is also smart. God gave us a beautiful immune system, and your body recognizes that this is not normal, and your body attacks it. And your body develops antibodies to this spike protein that you have been told to make through this messenger RNA, and your body then eradicates it. And your body now is prepared to eradicate any type of spike protein that it comes into contact with, including spike protein that's on COVID-19, the virus that causes all of the illness that we're dealing with. So should a person now be exposed through their life, through their work, through whatever mechanism to COVID-19, they're not starting from scratch. They have a full army in their body ready to fight it. And boy, does it fight it. These vaccines are extremely efficacious. You have two studies that were done simultaneously with similar but not identical products that both worked unbelievably well. If you had asked almost all the experts beforehand, Would you be satisfied with an 80%, even a 70% success rate? All of us would have said yes. In fact, it's 95% effective in preventing the people who got the vaccine versus the people that got the placebo, the sugar water in their arms, nothing in their arms to protect against COVID. So this is extremely effective, much better than most of us had hoped for. And both of these vaccines, done in totally large separate studies with a placebo, with the sugar water arm to show that it's real, both of them had identical results, both in terms of their efficacy and in their safety. And that's critically important. We'll discuss later on in our panel by others as well. But one should take it to the bank and know for certain that these vaccines are extremely good. They really, really prevent you from getting sick. Even if you do get illness, you get very mild illness. COVID is a killer. I hate to tell you how serious COVID is if you don't know, because it will scare you. We see young people, unfortunate tragedy that a representative of the House of Representatives of the United States was supposed to take office in a few weeks. A young person with no underlying risk factors, a 41-year-old person, just died. We see this, unfortunately, not uncommonly. Thank God, young people tend to do better, but they still can get very sick. Even if thank God, they don't die. They can get very serious illness and significant suffering. There are long-term problems, even in young people. So there's a myth out there that if you're young, you don't get into trouble with this. You can. And that's why it's important that everybody eventually take this vaccine, and especially the people at the highest risk, which are generally older people and people with underlying medical problems. So who should get this vaccine? Eventually, everyone. There are a handful of people in the country that shouldn't get it. Basically, those people that have had an allergic, serious anaphylactic reaction to the vaccine. That's the only real major contraindication right now. There are others that have had similar reactions to either other vaccines or to some of the components of these vaccines who had almost death experiences. They shouldn't get this vaccine. When in doubt, discuss this with a wonderful immunologist like Dr. Hirsch or other immunologists in our community that are wonderful. And in those situations, an infectious disease person, an immunologist can help you decide, are you one of those rare people? And I'm talking rare. The vast majority of people, well over 99%, can take this vaccine without concern or hesitation based upon their allergy or immunological past history. So everybody should get this vaccine. As has already been outlined, each state has a plan that it rolls out through the State Department of Health underneath the leadership and guidance of the governor as to who should get prioritized. And almost all the states, as far as I know, are following the Advisory Committee on Immunization Practices recommendations, which are sound recommendations in terms of let's vaccinate the people that are most at risk first. And this will include upfront the healthcare workers. I'm proud to say I got vaccinated as a frontline worker, and I'm proud to say I look forward to getting my second shot next week. And all of my colleagues who are getting vaccinated are excited and happy and thrilled to do this. Because unfortunately, healthcare workers have been one of the highest risk groups in the country for getting sick. And there have been, unfortunately, a very high number of deaths in our family, and therefore in the healthcare family. And therefore, they are certainly right up there at the top. And all people in healthcare should get vaccinated as soon as the vaccine is available to them. And all the high-risk people of older age, much older than me, 20, 30 years older than me, but even at my age and a little bit older than me, would fall into the highest risk categories, and they should be vaccinated as soon as it's available, which will hopefully come in January. Likewise, people a little bit younger, between the ages of 16 or 18 and 65, who have underlying medical problems, will also fall into that first group, what's called the 1C group, and they should all be vaccinated. But that's not to say the other people shouldn't get vaccinated. As soon as there's enough vaccine, and through the bipartisan work that Congresswoman Rice spoke about, there will be hopefully enough vaccine to get everybody in this country vaccinated, hopefully by the middle of the year, if not a little bit later. And everyone should get vaccinated. Right now, it's not approved yet in children. The Pfizer vaccine is approved in people from 16 and up, Moderna from 18 and up. The studies are underway right now in younger adults as well and in children. And therefore, once those data show that it's safe, as everybody expects that it will, of course, I never want to say you should take something until we have the proof. We have the proof for adults. We need to get that proof for children as well. As soon as we have that proof, so then children will take it also. The immunity that you get from this is expected to be very good, but we don't have long-term data on how long it will last. But the preliminary data on antibody production is very, very good and very solid. It's actually higher than the immunity that you see in people who actually got COVID. So it's a very promising idea that it will last for a long period of time. The studies to show that these vaccines are effective were done rigorously. No steps were skipped. There was phase 1, there were phase 2, phase 3. No steps were skipped. The rapidity via which it came out is a credit to the Congress, the Senate, the president for having Operation Warp Speed. It was phenomenal. It sped things up without in any way limiting the proper controls and all of the safeguards to make sure these vaccines are as effective as could possibly be. Now, there's a lot of concern about the new United Kingdom strain, and there's a South African strain, there's a Belgium strain, there's all sorts of strains out there. These viruses mutate. Actually, they mutate less than many other viruses, but all viruses mutate. And the concern that people legitimately have is, will these viruses not work? Will the vaccine not work against these strains? So I want to reassure everybody, there's no evidence at this point in time that any of these new strains would be not well protected against by taking these vaccines. Now, we take 2 shots of these vaccines because we get better immunity with the 2 shots. You get some significant immunity about 10 days after your first shot. But we want to give people great immunity, not just good immunity. And that's why we're following the guidelines from the protocols where they were given 2 shots. The 2 shots should be given at certain times. From Pfizer, it's 21 days after the first shot. From Moderna, it's 28 days. They arbitrarily chose those in the studies. But it actually was recommended that you take that second shot anytime after the 21 or 28 days, respectively. And in England, they're actually going to wait a little bit longer to try to give more people the shot. Those are 2 different approaches. I'm personally preferable for following the studies and using the United States approach, which is to get the second dose as soon as you can at the 21-day or the 28-day mark for each respective vaccine. As I said, you can't get the virus from the vaccine. What we don't know is, could you possibly still transmit virus? Now, from the Moderna study, there is a suggestion that you cannot transmit the virus. Certainly, it's not proof positive, but we're hopeful that people who get the vaccine will not be able to get an asymptomatic case of COVID, meaning that they feel fine. The vaccine worked to protect them from getting sick, but they could still carry the virus and transmit it to somebody else. We're hopeful that that will not be the case, but we don't have enough data to support that yet. And therefore, it is critical that people who get vaccinated still mask, social distance, etc., to make sure that they don't transmit virus. In addition, while it's a great efficacy, it's still 95%. That means some people will get COVID. So that's another reason why everybody still should mask and social distance until we reach that magic herd immunity. Now, we have no reason to think at this point in time, it needs to be studied, can the vaccine help people who have COVID already and have symptoms from COVID, what are known as the long COVID or the long haulers? So we don't know if the vaccine will have any benefit against those people. Certainly at this point in time, we don't give the vaccine to people with COVID as a therapeutic measure. However, if you had COVID in the past, the current suggestion is if you had it more than 90 days ago, you should get the vaccine. Now, people who had COVID in the past are at a lower risk, but still can get a second episode of COVID. So we do recommend that people more than 90 days from their prior COVID, or if they were treated with monoclonal antibodies, 90 days from the time that they were treated with their monoclonal antibody, we do recommend, the official CDC recommendation is that you should get the vaccine. And finally, are there subgroups of people that shouldn't get the vaccine? And the answer is, other than those that have the anaphylactic concerns that I mentioned before, those severe allergic reactions to an injectable vaccine or medication, those are the only people that absolutely should have a question, should they get the vaccine or not? But everybody else, if you had a bad food allergy, if you've had other troubles, you have autoimmune disease, you have immunocompromise, those are the people that especially should get the vaccine. People who have obesity as a problem, diabetes, high blood pressure, chronic lung disease, heart disease, you're exactly the people that should get this vaccine. If you're a woman, 50+% of the country are wonderful women. So they absolutely should get the vaccine. There is no concern that's been identified anything about infertility. There's a lot of nonsense that you'll see on the internet. Not a shred of evidence to suggest that this vaccine causes male or female infertility. In fact, there's evidence that COVID can cause some infertility. So therefore, you certainly want to take the vaccine to prevent infertility. Even pregnant women, the American College of Obstetrics and Gynecology says that pregnant women can take this vaccine. There's no reason in our 100-year history of vaccines to think that a non-live vaccine can cause these types of significant concerns. And therefore, a pregnant woman who is at risk of getting COVID, she hasn't had COVID in the past, I would strongly recommend that she take the vaccine. And this applies to a lot of nurses, doctors, respiratory therapists, other people that work in the hospital who are actually pregnant right now. And I would recommend that they get the vaccine because COVID in pregnancy is a serious problem. And the theoretical chance that maybe this vaccine could have some unknown, unrecognized, very rare side effect is not worth the serious risk of getting COVID in pregnancy. Women who are lactating, women who are nursing their children, they can get this vaccine. Women who want to become pregnant can get this vaccine with no concern. You don't have to take birth control to take this vaccine. There are so many myths out there. I've used up my time. I hope I've answered a lot of the questions that have been asked. I'll be happy to answer any additional questions later on with this esteemed panel. Again, it's my honor to be here tonight. I thank Jade and the Gural for putting this together. Again, honored to be on with all the other panelists tonight.
Thank you, Dr. Glatt. Thank you for that wonderful overview and for answering so many of the questions on everyone's mind. I'd like to bring in members of our esteemed panel to join us for a roundtable discussion on vaccine distribution and safety. I'd first like to address this first question to Dr. Eisenstein, our Commissioner of Health for Nassau County. Dr. Eisenstein, we've seen many first responders and officials getting vaccinated, and we know of this huge effort to reach healthcare workers who have put their lives at risk daily and people in residential care centers. And all of this is wonderful, but the general population wants to know when. When can they expect to see a rollout? Is there a timetable in place? And what will those logistics entail? Thank you.
Sure. So the good news is each week more vaccine is available to our system. And each week the governor has put out a new list of expanded groups of people who qualify for the vaccine. The first week it was high-risk hospital workers. Next week, which is week 4 in group 1A, as Dr. Glatt referred to before the various groups. Next week, I've received a lot of calls at the health department from healthcare providers who are not hospital affiliated or are dentists or are in a situation where they didn't qualify yet. Next week, almost all healthcare providers and all healthcare office staff, anybody in healthcare that deals with the public face-to-face will qualify for vaccine. We're going to be very excited to announce the health department's initiative next week to stand up our vaccination events. We couldn't do that until there was enough vaccine available for us to receive some. The first shipments went to the hospitals, and rightfully so. So each week it's expanding. Dr. Fauci said recently, I heard him say that by June, he thinks every American who wants it, and as Dr. Glatt said, that should be everybody, will be able to get it. That would be great because it would put us online for a relatively back to normal summer. And I think that's a reasonable, hopeful target. If you said to the medical community back in March and April, by the end of this year, by New Year's Eve, there will be a vaccine that millions of Americans will have received. And as of today, 2.5 million Americans, most of them healthcare providers, have already received the vaccine. We all would have signed for that in a second and thought that would have taken a Herculean, almost miraculous effort to do it. And we've done it. And so we just ask people, just hang in there a little longer. When this will happen does have to do with a third product, as Dr. Glatt talked about, reaching the market, the Oxford AstraZeneca. Johnson & Johnson has a product that might reach the market a little while after that. That is slightly different kind of vaccine, but it has the benefit of only requiring 1 dose. And so that's also going to be a game changer. Right now, one of the challenges is the 2 vaccines we have require 2 doses. So we still have to give second doses, which takes up slots for people getting first doses, but we will be announcing next week what the county's doing. We're partnering with our hospital providers. I want to thank Dr. Lawton, Mount Sinai South Nassau. They immediately, when we needed help, stood up that testing site at the Gural JCC in the Five Towns Community Center. And anytime I've ever called Dr. Glatt from the health department, he's been an incredible partner. So thank you. And so the answer is, we don't know for sure, but I am hopeful that sometime in the spring, the majority of Americans will be able to get it. And by late spring, or maybe at the latest early summer, I'm going to be hopeful. But so far, we've been hopeful with vaccine, and it's here. For some people, it's here. That is, to me, incredible. And so I'm going to say, I'm going to stick with Dr. Fauci and say late spring. I think just about any American who wants it should be able to get it. And stay tuned, because each week we're going to be announcing, and County Executive Curran does the great daily briefings you've all come to know and see. We're going to be announcing each week as the new groups become eligible, and we're going to be informing people when their group is eligible how they can go about getting it.
Wonderful. Thank you so much, Dr. Eisenstein. It's a huge project, and rolling out a new vaccine for over 1 million people in Nassau County is a huge endeavor to take on. So thank you very much. Next, I just want to ask Dr. Alt-Brutus, our Director of Health Equity for the Nassau County Department of Health, what are the different phases of the rollout plan in terms of how are we going to ensure the equitable distribution? Can you speak about the goals you hope to see as far as getting into different communities and how announcements might be made?
Yes, thank you for including me in this very important topic tonight. One of the things that we really need to do to ensure equitable distribution is partnering with our community, partnering with our trusted community leaders and stakeholders. We can see from past immunization efforts, especially with influenza, that when you partner with the community, you get higher rates of taking the vaccine. So it's important that we partner with them not only for messaging, but partnering them from the very beginning in designing the plan for distribution. As you mentioned earlier, in our region, we're going to have a health equity task force, and actually Farah from Office of Asian Affairs is on it. I'm also going to be on it. And it's my hope that on this task force, we'll have other members of the community, which I believe that is the case. And we're going to be designing how we're going to ensure that we remove all barriers to receiving the vaccines and making sure that cost is not an issue, ensuring that it's free for those who cannot afford it, ensuring that it's available in all places, available by public transportation, by walking to places where they could get the vaccine, also ensuring that it's available at times, all times of the day, in the evenings, on weekends, for those who are essential workers and cannot go during normal business hours. Also ensuring that it's ensuring people know that it's safe, because as you know, there's a history of distrust, especially in the Black community, and also Native American and other communities of color, with past mistreatment. And we need to do our part as healthcare providers, as county officials, as government officials, in spreading the information that's accurate, science-based, and ensuring all members of our community are getting that information that these vaccines are safe and effective in fighting against COVID-19. And the last thing I would say is that there are a lot of people who are currently right now debating whether or not they're going to get it. As we know from various studies, unfortunately, Black and brown communities are less likely to say they'll get the vaccine compared to their white counterparts. And I think that it's really important for us to think about the risk and benefit. I remember when the nurse from Northwell who received the first vaccine in the country said that she worries less about the COVID-19 vaccine as opposed to COVID-19. And I really think that all of us need to really think about, not only for ourselves, for our loved ones, for our community, the risk and the benefits, the benefit of protecting yourself and protecting your loved ones and your community.
Thank you. Definitely, I agree with you 100%. And we really have to work on breaking down the vaccine hesitancy in all communities. Thank you, Dr. Alt-Brutus. I know Ms. Mazzawala has actively campaigned on vaccine education over the recent period, and she's received many community questions that have been asked on these online events that she's been able to attend. So Ms. Mazzawala, Farah, would you be able to answer a couple of questions that community members had as far as how would someone find out where they are in line? Will there be a central tracking location or hotline? And how can they get more information? Will it be distributed? Will there be public service announcements in different languages?
So thank you so much for having me. Right now, as County Executive had also mentioned, and Dr. Eisenstein, that Northwell Health is the regional hub for Nassau County and all of Long Island. There's 10 regional hubs within New York State, and Northwell Health is our designated hub. They are going to be setting up a website where all of this information will be available, and we are part of their health equity task force, where we're going to be able to input our information. And as Dr. Albrightis had said, I just want to piggyback off of what she had said, that historically within these minority and marginalized communities, there has been distrust for the health care system and for doctors. So we want to make sure we partner with community members and community leaders so that we have the buy-in from all of these different communities. Because if you don't have the buy-in from the immigrant and minority communities, that's 30 or 40% of your population. So in order to have that herd immunity, you really need their buy-in. We want to make sure that we reach them. There's so many language access barriers, and we want to make sure we reach them in their different languages. We use their mode of communication. For the Asian constituency, that would be like WeChat, WhatsApp, Viber, ethnic media. So those things are important. We want to make sure that we are able to explain to them that there's 2 shots that are required. So all of this has to be done with community partners and community stakeholders, so we can make them vaccine ambassadors for the different communities to promote the vaccine, to create awareness, and to dispel some of the myths surrounding and rumors surrounding the vaccine.
Thank you so much, Farah. Thank you for giving us hope that the vaccine will be available, organized, and distributed to all communities. Now comes the concern, as you had mentioned, about this vaccine hesitancy. And I'd like to ask Nurse Marcus, Blima, if you could speak to us. Ms. Marcus has dedicated her career to outreach and education. And there have been many questions and concerns about possible side effects from the vaccine, as well as adverse outcomes, in particular the one that Dr. Glad had mentioned regarding infertility. Would you like to address that at this time?
Yeah, hi, Dr. Hirsch, and thanks for having me. I'm really enjoying this conversation. It's really interesting because in 2019, the World Health Organization designated vaccine hesitancy as one of the top 10 global concerns. And it's just ironic that a year later, here we are in a pandemic, which is both raising a lot of concerns about the vaccine that appears to have been developed so quickly, while at the same time giving people a sense of urgency for wanting the vaccine so that we can stay safe and open up our society again. So when it comes to vaccines, people can get really concerned about the unknown. And the theory is that we can always get the vaccine later once there's more information. So when it comes to questions like that, I find that approaching it 2 ways is very helpful. On the one hand, giving people the actual information of what we know and refuting a lot of the wrong tidbits that are floating around. But the second thing I also like to do is kind of put what's going on in perspective. So while people say, well, I haven't seen a year or 2 of data yet, the reminder is that we're losing 20,000 people a week to COVID. And that kind of perspective sometimes reminds people that on 2 group studies between Pfizer and Moderna that have studied 70 or 80,000 participants and found it overwhelmingly safe. When we look at the alternative, which is to wait for more data, we really can't afford that alternative, which is such a huge loss of life. So really reminding ourselves of where we are right now in the United States, which is a really, scary time for so many people, combined with all the information that we do know and that we keep sharing with people, really helps dispel a lot of the fears that people are holding on to. When it comes to concerns about side effects, in general, despite the fact that this is a new technology vaccine, which Dr. Glott mentioned has actually been studied for 20 years, the side effect profile is really similar to all vaccines, which is an immunological response, fever, arm discomfort, body aches, and this all starts within a couple of days, if you're even going to have that side effect. This is not something that starts a week or 2 later. So you can expect possible side effects early on, although most people are reporting feeling totally fine. The likelihood of developing an effect from a vaccine after the first 3 to 4 weeks is very unlikely, building on 100 to 150 years of vaccine science. So I'm feeling really reassured with all the data that keeps coming out. I'm following it all really closely. Dr. Glock covered the allergy really well. And as a reminder, we've given over 2 million vaccines in the United States, and we've seen approximately 10 allergy reactions, and those people are all fine. So that really just shows us that your risk of that is 0.00005%. Again, that's the perspective I like sharing with people, because the news shares the scary stories, but not all of the success stories.
Correct, exactly. Thank you so much. I really appreciate it. It's so wonderful to have you join us in this chat as well. I'm going to circle back to Dr. Glatt for a moment. And I wanted to ask Dr. Glatt if he could explain to the public, why is it necessary for the mass vaccination? I know we've discussed herd immunity in the past, but as far as the group, what number are we looking for? It's changed over the last month or so. And could you touch please on herd immunity?
Sure. So herd immunity is a very well-known and understood concept, which we have hard evidence for certain other illnesses, which we've had years and years of clinical experience seeing what it would take practically to prevent and stop further spread. So for example, with measles, which is a very good example, we know that you need about 90% of the area to be vaccinated to really be able to stifle and prevent significant additional spread. Now, everybody has to understand that herd immunity doesn't mean that you can't get it if you're capable of getting it. It just means you're much less likely to come and be exposed. Even if there was 99% herd immunity, but you and the one other person in the world who aren't immune, and that person gets it, you're going to get it depending on what the likelihood is when you're exposed to get the disease. Something like measles is almost 100% chance you're going to get it. Something like COVID is a very high chance you're going to get it if you have a significant exposure. So the fact that everybody else is safe won't help you if you get exposed to somebody. But the idea behind herd immunity is there's so little ability for the virus to spread, because every time it hits somebody, it can't infect them because they're immune. So the virus dies out when it has nobody to be spread to. In your own body, the person will, if they survive, thank God if they survive, they'll eradicate the virus. The virus doesn't jump to somebody else, and if there aren't a lot of people to jump to, we will end this pandemic. The only way you can get rid of a pandemic is by vaccines. You cannot get rid of it by just, let's get the entire country, the entire world infected. Because first of all, there are second cases. Thank God, not that many. But you're never going to get the entire world infected. Plus, that would be a horrible idea in terms of loss of life. But a vaccine doesn't cause loss of life. The vaccine gives you built-in immunity without having to be sick. And therefore, the estimates are anywhere from 70 to 90%. If we could vaccinate 70 to 90% of the population, and really we don't know, what does that mean for people that aren't vaccinated but had COVID, how much they'll contribute towards that herd immunity. So given a lot of these unknowns, the best recommendation is get vaccinated. Whether you had COVID or not, get vaccinated. Certainly if you're in the higher risk groups. But the only way we'll eradicate COVID is by getting some magical level of herd immunity. And my guess is it will be somewhere between 70 and 90%.
Thank you. Dr. Eisenstein, that if we have 1.3 million people in Nassau County and we want to vaccinate 70 to 90%, one of the questions a lot of people have on their mind is, what will the cost be? Will they have a cost to incur from getting vaccinated? Are you able to address that?
Sure. And so we want to vaccinate 100% of people, but it'll take 70 to 90% to reach herd immunity somewhere in there. So laws have been passed that people may not be charged for the vaccine. And so the providers, the hospitals that are giving it to their workforce now, the health department's going to stand up pods starting next week. As more providers, as more vaccine becomes available, more providers will be giving it, and there should be no charge for it. Everybody should be able to afford to get it for free.
Okay. I was just wondering, will there be a charge if they do it in their private provider's office? Do you know?
So private providers can't charge for the vaccination. Now, if somebody goes when the time comes that every doctor's office has this, which hopefully by the summer, even before, hopefully before that, I want to be hopeful, and sometime in the spring, if somebody goes for an annual physical, they're still going to have to pay their copay for their annual physical, but there can't be an added charge for the vaccine. And for people just being vaccinated, it's covered under the law.
Very great. Thank you so much. Dr. Albrutis, what do you think might be necessary to say, in addition to the community, how do we build trust in marginalized communities to take the vaccine?
Well, as I said before, messaging is very important. That's diverse, meaningfully diverse, and meaningfully inclusive. Also, I think it's great that we're seeing across the country, Black and Brown providers, doctors, nurses, taking the vaccine and telling us why exactly it's important to them to take the vaccine. And I also think that's important within your families, within your own social networks, to have conversations about taking the vaccine. I know within my own family, for example, my father-in-law, who is a physician, just a week ago was still debating whether or not he'll take it after looking at the science, talking to colleagues and other members of the family and his social circle. He's now decided to take the vaccine. And I have to say, even my own mother, who is a retired ICU nurse, so she's not working anymore, but she's someone who I need to take kicking and screaming to get her flu shot every year. She even told me that if she was working now, she'll take the vaccine. So I think it's just more conversation and more of us, more information in the media, just letting us know that here are my thoughts about the vaccine, here's why I'm taking it, and look for yourself, look at the science and see the importance of why taking the vaccine is useful for yourself and for the community as well.
Thank you. The next question could be answered by either yourself or Farah, whoever would prefer to take this if there's an answer. Will undocumented residents be allowed to get vaccinated by the state? Will it be available? Do we know? And should they be worried? I know a lot of people have concerns about revealing their status if they go to a vaccination center. If anyone can answer it.
So for our office, we get about 100 to 150 calls weekly for various topics. And the number one call that we're getting in terms of the vaccine is the same question about the immigration status. Will there be personal identifiers used, like, IDs or social securities for this process of getting the vaccine? And there will not be any personal identifiers used. Your immigration status will not be asked or questioned while you're getting these vaccines. And that's something New York State has provided for us to let us know that on a federal level, they will not be asked. And Dr. Albrutis, you can add to that.
No, I agree. And I think we saw that with the COVID test as well. That question often came up for testing. And, we partner with the federally qualified health centers, for example, for COVID testing. And that question often came up, and questions about your immigration status is never asked.
And if I could, I'll just add to that, this is not our first viral pandemic that the health department has ever dealt with. It may be the biggest one, it may be the one that's impacted our lives, but you have a health department in Nassau and in every other county to deal with communicable diseases. And actually, I first was employed at the health department as deputy commissioner with the purpose of managing the H1N1 pandemic, which seems like such a minor deal now when you look back, but that's how I got my job at the health department to begin with. And one of the things that we did was community pods, purposefully reaching communities where people were unlikely traditionally to receive healthcare or go for healthcare. And one of the things that the health department has worked very hard at, and we're very excited to have Dr. Albrutis helping us with this, is the health department's sole purpose is to prevent the spread of disease. We don't care where you're from. We don't care what your status is. We don't care if you have insurance. If the health department is vaccinating you, none of that is going to be a reason to not be vaccinated. We're not going to ask. The only reason we're going to be taking down information with regard to this particular vaccine is because we have to, right now, all of the vaccines require 2 doses. We have to keep track so you get the right second dose. That's it. There's no other motive. There's no other issue. We don't ask the immigration status. We just want to prevent the spread of disease for everybody, period. That's our mission.
Thank you. That is very reassuring, I'm sure, for members of the audience. So thank you very much. We've covered many topics here. I hope that we've reassured the community. We have a list of questions that we've received from people who had registered in advance and emailed to us. And Ms. Mosery, Amy, and I just want to go through what we would call a lightning round, and feel free to answer, jump in at any point. The first question was, if I could ask you, show of hands, how many of you on this panel would urge your loved ones to be vaccinated? Okay, speaks well. To Nurse Marcus, a question that Dr. Glad answered that I just want to reiterate because it's come up many times. Can patients stop wearing their mask once they're vaccinated? Why? And what's the answer?
So the answer is absolutely not. And I'm sorry, I'm told there's a lot of background noise, but I hope you can still hear me clearly. Okay. No, you absolutely have to continue to still socially distance and wear your mask. And that is because it takes time to build that level of immunity. Just now, there was a conversation with a couple of colleagues where someone got their shot, but a week and a half later started feeling feverish, which is late for a vaccine side effect. So she may have developed COVID in between. So you're really not that well protected that you can afford to put other people around you at risk.
Thank you so much. If you know you had a recent exposure to COVID, should you try and get the vaccine as soon as possible or delay until your PCR comes back and then wait the 90 days as per CDC?
So the CDC has recommendations on this. They're not based upon a lot of evidence. At the current time, we don't recommend vaccinating somebody who is currently in quarantine or isolation based upon their either exposure or actually having COVID. And two separate issues there. The main reason that we don't want somebody in quarantine, meaning they were exposed to somebody and we don't know if they have it or not, is because when they go in to get vaccinated, if they have COVID, they'll be exposing the entire vaccination staff. It's not so much that it's dangerous to you, but we don't want you to expose other people. If you actually have COVID, so we don't think that the vaccine would hurt you if we gave it to you. It probably will not help you either. And the CDC suggests waiting 90 days. It's not hard and fast. They suggest waiting 90 days after having had COVID, or likewise, I mentioned before, if you were getting monoclonal antibodies. So we recommend waiting 90 days till you get your vaccine. Not because it's dangerous, but we don't think it will really be a benefit in that short period of time when you have natural immunity. Very, very, very few, if any cases, get second COVID within 90 days. So get that second shot of prevention, so to say, your vaccine, after your episode of COVID has maybe diminished your immunity by being 90 days out.
Dr. Glatt, you might want to take part 2 to this question. If someone receives the vaccine and has a strong immune response, can they donate convalescent plasma? Can they donate their antibodies post-vaccination?
So we have no evidence for regular convalescent plasma therapy that it really is very effective. There's the hope that it still is. We've used it quite a bit, but the data actually aren't strongly supportive at this point. There are hyperimmune gamma globulins that are being studied right now at Mount Sinai South NASA. Will be starting such a study shortly. There are studies like this underway across the country that will investigate that idea of giving a very high dose of the vaccine. Some of the convalescent serum have high dose, some of them don't have high dose. At Mount Sinai on the city, they're actually doing a study looking at the low dose versus the high dose versus placebo convalescent plasma. So a lot of these things are unknown. I would not at this point tell anybody get vaccinated so you can donate, but get vaccinated so you protect everybody around you from getting sick, including yourself.
Okay, as part of the lightning round, is there any medical reason to choose one vaccine over another if someone has a choice between Pfizer or Moderna?
Take whatever you can get as quickly as you can get it.
Okay, great. Is there, this came from a food service worker, concern, will I be forced to receive the vaccine if I work in a service sector?
So it's interesting that would have to be legislated. Right now, the vaccines are under emergency use authorization. They're not formally approved vaccines, and it's actually against the law that people cannot be mandated to be vaccinated with something while it's under emergency use authorization. After that, various states have legislation with various other vaccines, but we don't have any evidence. There's no legislation that I'm aware of in New York for that type of situation now. So if that were to be the case, it's way down the road and we'd have a lot more information. So in the near future, I don't see that happening. And certainly we're not even up to being able to vaccinate the entire food service industry. So that's a question probably for down the road.
Okay, great. To Lima, if I could just call you back in for 1 sec. If for people who are vaccinated, questions came in about Bell's palsy. Was it permanent, temporary? What's the risk? I know you can speak to this. We've talked about it.
So what's interesting about Bell's palsy is that it's not an uncommon syndrome, and it's something that can occur post-viral, after any virus. So there really isn't a lot of evidence to suggest that it's necessarily related to the vaccine, as opposed to something that may have occurred spontaneously in the vaccine trial study, which had 50 or 60 or 70,000 participants. So far, I have not seen any data that it's caused by the vaccine. However, what we do know is that it's not a dangerous syndrome. I haven't seen any reports of it since the vaccine rollout has begun. So I'm curious to watch that and see a little more, but that's not a very big concern of mine right now. And I don't think it's a big concern for many people right now.
Right, with 2 million people vaccinated in these last couple of weeks, we haven't heard anything since the trial. So it'll be curious to see what comes after second dose and everything else.
Yeah.
Alyssa?
Yes, Amy.
Alyssa, can I jump in?
Yes, please.
We have a question, an extra question from Facebook. The question is, will the vaccines be needed to be taken yearly or just this year?
So I'll maybe give a shot at answering that. I will tell you the answer to that next year. Right now, it's just too early to say for sure. I think that we're hopeful that it won't need to be taken on a very regular basis. You don't need a booster every 3 months, every 6 months. There's no reason to expect that. But there are many vaccines that you take once and they're lifelong immunity. And there are other vaccines like influenza, because of so many mutations in the virus, that you need to take them every year. And even then, they're not as effective as we would like them to be. So the jury is out. We don't know. We're certainly hopeful that it will be something that will provide a long-term immunity. Question is, what does that mean?
If I can jump in really quickly, okay. So I'm pretty sure there's some data on people who had SARS back in the early 2000s, and I'm pretty sure that the data I've seen is that they are still immune to, SARS coronaviruses 17 years later. So there is some hope that long-term immunity might be gotten either from people who had the virus or from the vaccine. So I'm hopeful that Rabbi Glatt might be right, and that we'll get longer-term immunity than some people are worried about.
Amy, is there other questions from the
Yeah, I'm going through them now, Alyssa, so you go ahead.
Okay, perfect. I'll send this one to Dr. Eisenstein or Dr. Albrutis. Is there any concern, not just about having enough vaccine, but having enough of the supplies, the needles, the gloves, everything that we suffered a shortage of during the surge of the pandemic, that we won't have enough of those products?
Well, right now, the rate limiting step is we don't have enough vaccine to open it up to the general public. And so you asked that question earlier, when can the general public expect to be vaccinated? The answer is as soon as there's enough vaccine and little glass bottles and the little corks that go in them. But we've seen this is just the third week of this. And the very first week, there was only about 100,000 doses came to New York. The next week, another couple of 100,000 doses are coming. It's going to exponentially expand. And we always keep our eye on the supply chain, but I've not heard of anything that will slow down vaccine from coming other than the rate limiting step of producing vaccine. So, and I also think once we have a third and a fourth product on the market in the spring, hopefully February or March for that, then our capacity to vaccinate should rapidly increase. And so I'm asking, just bear with us a little bit longer and we can get to a nice summer, at least part of it. And I'm not worried about the supply chain. I haven't heard of it. I think that just producing the vaccine right now is going to be, what's the slowest step. And then of course, getting it out. And so we're working Once we start vaccinating at the health department next week, that's going to be 7 days a week indefinitely until we vaccinated everybody. And it won't only be in one spot. It'll be with our partners, with our hospital partners, with our community-based partners, with our mobile vans that our partners have, reaching hard communities to reach and at-risk communities. And this is going to be, I sent an email to the entire staff at the health department today. This is our mission for the next, foreseeable future of months. Vaccinating people saves lives. It's one of those things we can do that flat out saves lives. And when you get to do that, it's very satisfying. And Dr. Glatt, as you said it before, is right. If you're not sure what to do, this virus, there's no other way to put it. This virus will kill you. If it doesn't kill you, it will kill your loved ones. We have a safe vaccine that can prevent that. Be smart.
Yeah, 100%. I'm going to go to the next question.
Jump in?
Yeah, sure.
Thank
Oh, you're on mute, Amy.
I'm fixing it. Another question from the audience. What if the person that has developmental difficulties or neurological impairments, can that person receive these vaccines? And have there been any neurological impacts from these vaccines?
So there's no contraindication at all based upon the conditions that you just mentioned. The only question might be a legal question: who's the guardian to give permission to give the vaccine? Because it's under EUA, so you can't just mandate that it be given, as Dr. Eisenstein mentioned. But from a medical point of view, there is no concern. They're in a group setting. They're at extremely high risk. And unfortunately, we've seen the terrible toll in the nursing home populations, which is the equivalent of a group home in terms of the devastation and the horrific outcomes from not vaccinating or not having the capability to vaccinate that group. That would be amongst the highest risk people and should be vaccinated. There is no evidence of neurological deficits. Guillain-Barré, which is often talked about, is not a contraindication to the vaccine. No underlying neurological disease is a contraindication to taking the vaccine. This is great news for all of us.
Thank you, Dr. Glatt. I'm sorry for interrupting. I have another question from the audience.
If I could just say, that point is so important. The danger is not taking the vaccine for somebody who might have underlying health conditions or live in a group setting. The danger is not getting that vaccine. And that's the important point. That the answer is contrary to that question. I fully agree with Rabbi Glatt.
And thank you. And another question from the audience. So for the people that are first in line and take the vaccine, and by the time we get to the people at the end of the line who are taking the vaccine, is there concern that those people that took it first several months, 8 or 9 months earlier, will no longer be the vaccine will no longer continue to be as strong or as for people who had, for those people, for that population? Is there concern about that?
There's no evidence that is true. In fact, the most recent publication, New England Journal of Medicine, actually showed very good news about natural COVID immunity, that it actually persists longer than we had previously thought. As we're getting more and more experience and have more and more months of people being from their original illness, we're seeing very good news in terms of the antibody presence and the lack of illness in that group. So all the more reason to think that this vaccine, which provides on many levels a higher immunological response than does natural illness, we should hopefully be in very good position. And nothing would please me more than to be able to definitively say, yeah, we're all vaccinated, and the guys that got it first, the gals that got it first, they're still doing fine.
Thank you, Dr. Glatt. Back to you, Alyssa.
Okay, I have one last question here. If someone has long COVID, or what's referred to as long haulers syndrome, should they not receive the vaccine? Should they be worried about stimulating an immune response that would be dangerous?
So again, I'll answer that as well, but there's no evidence for that whatsoever. We don't give the vaccine to treat COVID. People have to understand that. There are some vaccines under certain situations that are used as a therapeutic measure. There is no evidence at this point in time that it would or would not be effective in treating somebody who has COVID symptoms, but that's not the purpose of giving it. But certainly, again, as I said before, after 90 days from having had COVID, the CDC recommends that you take the vaccine.
Thank you. I wanted to just add a point in response to the question about the patients with developmental disabilities or immunocompromised. I just, on a personal note, I have a sibling who's severely developmentally delayed. And throughout this period, one of my concerns has been, what if he contracted or was, contracted COVID and ended up hospitalized and not allowed visitors in a population such as where he lives, where there's not great communication skills, he can't easily represent for himself. Those are dangers and concerns. And the idea of him being able to get vaccinated and not have that concern that he could end up in a hospital where there's nobody to advocate for him, that's something that makes me very excited and hopeful. And as far as the safety of the vaccine, when patients or friends say, would you take the vaccine, or what do you think? One, I took the vaccine, and two, as I've shared with our panel, my 14-year-old signed up to join the Pfizer trial. So that was open for 12 and up. She hasn't been called yet. She was asked to come up to Albany, which did not work for my schedule to get her there. But that's how confident I am that the vaccines work and that it is the way to be able to move forward and to get out of the position we're in right now, which is not a good one. We need to do better and protect our community and our family and friends.
Alyssa, I want to ask you something. I
Sure.
understand that you are the administrator of a local physicians chat that has over 100 physicians on it. And I wanted to know, what was the consensus from your chat with these professionals as to whether or not they are stepping up to get this vaccine quickly, or they're hesitating?
I would say the vast majority would like to be vaccinated as soon as possible if they have not already been vaccinated. So overwhelmingly positive and in support of receiving the vaccine.
Great. Thank you, Alyssa.
You're welcome.
Let's see, Alyssa, do we want to wrap it up? Is there anything else
Sure.
that's
I think we should go to our closing thoughts and ask each member of the panel, what makes you hopeful? You want to take it away, Amy?
Sure. Well, after listening to all of these incredible panelists and our politicians, and I feel so hopeful personally, because as I started out the evening by telling you that this has been so difficult for me personally, but it's been difficult to watch what's happening in the world and to know that you professionals are telling us it's not only safe, it's more than safe. You can't ask for better numbers. This has been an incredible rollout. It's been, you all have convinced me, and I hope that you've convinced everybody else that is listening tonight that this is what we need to do. We need to protect each other. We need to take care of each other. We have a responsibility to each other. And I'm so grateful to hear all of this, because I can't wait to get it. And I'm hoping that, I'll get called up soon. You want to move it to the panel, Alyssa?
Yeah, sure. Dr. Glatt, would you like to share a minute of what makes you hopeful at this point?
I would just start off. I'm a religious person. I would thank God for giving the doctors the brains, the scientists to develop such a vaccine. And I hope he gives us all enough common sense to take it. This is a present. We've been given exactly what we've been begging and hoping and praying for. And it would be a horrible shame, just a tragedy, if people were to die because people mistakenly thought this vaccine was more dangerous or not safe to take. And that would be the real tragedy. When we have the ability to prevent illness, the ability to stop people from dying, the ability to stop people from getting horrible sickness, and if we don't take that, that would be a tragedy.
I agree. Dr. Eisenstein, could you tell us what makes you hopeful?
Yeah, for 10 months now, 9 months, I stood with County Executive Curran in front of the press and didn't have an answer how this was going to end. We hoped there would be a vaccine. We hoped it would happen sometime, quite frankly, in early next year. I'm hopeful because now I could stand up in front of the TV camera and say, we have an answer. It's just, we have an answer. Over 2.5 million Americans have already been vaccinated, and we're going to be out there vaccinating starting next week every single day, as long as it takes. We have an answer. It's just a matter of how quickly can we get it to people. And the other thing is, we do the contact tracing, we evaluate cases. The overwhelming, there are some people who follow all the precautions. They wear a mask, they wash their hands, they avoid distancing, and they get this. But in the majority of cases, we're able to trace it back to social gatherings, close contacts of various events, parties, team sports, that kind of thing. So I'm hopeful because A, we have a solution, and B, for those that aren't vaccinated yet, we know that most of the time masks work, social distancing works, taking those precautions works. And so until it is your time, Amy or whoever, to get vaccinated, until you do get the call, you can protect yourself. And it's not 100%, but most of the time it works. And so keep it up, keep up the masks, keep up the social distancing, keep yourself safe, and this will be over. Now we can say this will be over.
That's amazing. Dr. Albrutis?
What makes me hopeful is the community and how people are changing their minds about the vaccine. I mean, earlier on, a high percentage of people were saying, I probably wouldn't get it. But the operative word was probably. And now with more information about the vaccine and talking to other people within their own community, people are changing their minds about taking the vaccine or are taking the vaccine. So I'm hopeful that as more and more people get the vaccine and the science keeps showing that this is effective, this is safe, that even more people will take it down the road.
Thank you.
Okay.
Farah Mazawala?
So I'm hopeful in the confidence in this rollout, because our unity as a community, we've seen it in these dark, uncertain times where everybody came together. You know, we owe a debt of gratitude to our frontline workers who are still working to keep us safe. We owe a gratitude to our essential workers who continue to fuel our society so we can move forward. We owe a debt of gratitude to all of those people who are donating PPE and food throughout this pandemic. And we really came together as a community and a society. And I think in this rollout, we'll still have to come together and we have to be united and become ambassadors for this vaccine and make sure everybody gets the vaccine. There's finally
100%.
at the end of the tunnel.
Thank you. Thank you so much. Blima, Ms. Nurse Marcus?
Yeah, I'm really hopeful, specifically for my own patient population. I'm an oncology nurse practitioner, and my patients have been on personal lockdown for almost 10 months now. And I've been prescribing antidepressants lately. I've been doing so much hand-holding. They are missing their families. They have not seen people. They barely go to the grocery. They are asking for their vaccine, and they have suffered in ways that the general population probably has not. And it's very obvious with the care I provide that it's a huge struggle. So I'm just really hopeful that this might come to an end for them, where they don't need to be as fearful as they are, and that as the rollout continues, that they will be prioritized and get their vaccine soon, and have the opportunity of going out into the world a little more.
Amazing. Thank you so much. This was a wonderful panel. Amy and I are so appreciative of everyone's time and all your expertise. You've given us so much information here tonight and shared with the public. I hope everyone has a healthy start to 2021, and that we all will continue to wear a mask, wash our hands, socially distance, stay safe, and that we can convince, and by educating the community, that the vaccine is safe, to go forward and get vaccinated.
Thank you.
Amy, would you like, yeah.
Yes, thank you so much, Alyssa, and thank you so much for doing a phenomenal job moderating this very, very important and essential service. And again, my thanks, my deep gratitude to this panel for sharing with us all of your expertise. We were very appreciative, and I want to thank Congresswoman Rice and Nassau County Executive Laura Curran for joining us tonight as well. I want to thank the team at JADE for putting this event together. I want to thank the Gural team for partnering with us and helping us to make this such a success. But most important, I want to thank each and every one of you out there that's listening, because I know that after tonight, you're going to want to take this vaccine, and you're going to tell your family why they should take the vaccine, and you're going to talk to your friends about it, and anybody that's going to listen to you, you're going to talk to them about this vaccine. So I'm very appreciative. And so thank you for participating. We need to come together, everybody. It's our time now. It's our time now, and this is our opportunity. So let's all step up. Until we can get it, Let's not let our guard down. So thank you again, everyone. I echo Alyssa's words, wishing everyone a healthy, a happy, most importantly, a safe new year. And I really appreciate everybody's time tonight. Thank you. And by the way, you can look Jade up on Facebook, the Jewish Alliance for Dialogue and Engagement. Thank you again, everyone, and good night.
Good night.